President, I ask unanimous consent to vacate the quorum call.
Without objection.
Mr. President,
Senator Morgan.
Notwithstanding Rule 22, I ask unanimous consent that Senator Wyden, Senator Sanders, and Senator Scott be recognized for up to 25 minutes, and that following the remarks, the Majority Leader be recognized.
Is there objection?
Mr. President, I come
Without objection.
Thank you, Mr. President. I come to the floor, my colleague from Vermont, Senator Sanders, to pass a set of critical improvements to Americans' health care system. This legislation is overwhelmingly bipartisan, fully paid for, and targeted at two objectives every senator ought to support: improving health care for Americans and cracking down on the middlemen who take advantage of the system. 597 days ago, the Senate Finance Committee passed the most comprehensive legislation in history to address the pharmacy benefit manager predatory business practices, and it was passed by a vote of 26-1. 493 days ago, the Senate Finance Committee passed another piece of health care legislation that improves mental health care for Americans with Medicaid, expands and strengthens telehealth, and more PBM policies by a vote, again, of 26-0. Since that time, negotiations about how to sign these policies into law have been fatally intertwined with the dysfunctional debate over congressional appropriations, as the public can see on full display this week. These policies are too important to leave behind due to an unrelated disagreement. Community pharmacists are counting on this legislation. Doctors who don't want to see a pay cut are counting on this legislation. Seniors and working families who want better care at a lower cost are counting on this legislation. So the time to act is now. In December, Democrats and Republicans struck a deal on this bill. I have the press release on my website to prove it. It was introduced in the House and set for passage. But along came Elon Musk and his now familiar wrecking ball. With one tweet, he killed the entire package for reasons that had nothing to do with the bill before the Senate today. Musk even had the gall to tweet, "What is a pharmacy benefit manager?" less than 2 weeks after he single-handedly killed the bill, Mr. President. While this unelected billionaire rifles through Americans' private information and earned benefits, claiming to be looking for waste, fraud, and abuse, he doesn't even know about the middlemen who skim billions off the federal government. Since Musk's tweeting adventure, 237 independent pharmacies have closed their doors. That's nearly 3 small businesses closing every day. Our bill includes critical protections that stop the giant PBMs from bullying even more local pharmacies into the abyss. Every day matters. That's why it's critical to act now. Now I'd like to yield to the ranking member of the Health, Education, Labor, and Pensions Committee, Senator Sanders, so he can explain the important pieces of this bill that are in his committee's jurisdiction that also need to pass as soon as possible. Senator Sanders.
Well, thank you very much.
Senator from Vermont.
Thank you. Let me thank Senator Wyden for his outstanding work as the former chairman of the Finance Committee and now as the ranking member. Mr. President, I got around Vermont a bit. I got around the country a bit. And generally speaking, when I talk to a group of people, I ask them a simple question. I say, what do you think about the healthcare system? Is it working well or is it broken? Is it dysfunctional? And overwhelmingly, the hands go up that the American healthcare system today is broken, it is dysfunctional, it is cruel. And what people understand is the function of the American healthcare system today is not to provide quality health care to all of our people, which in fact goes on in every other major country on earth. It is to make huge profits for the drug companies and the insurance companies. Mr. President, the current health care system is a system in which we spend twice as much per capita on health care as do the people of any other nation. Astronomical sum of money. And yet, despite all that money, 85 million Americans are uninsured or underinsured, and the cost of health care keeps going up every single year. 1 out of 4 Americans cannot afford the cost of the drugs that their doctors prescribe. And unbelievably, it is a system in which 60,000 Americans die each year because they can't get to a doctor on time. It is a system in which we don't have enough doctors, we don't have enough nurses, we don't have enough dentists, we don't have enough pharmacists. But the good news is the insurance companies and the drug companies are making huge profits. The current healthcare system is a system in which our life expectancy is lower than any other major country, and if you're working class in America, you're going to live 7 years shorter life than if you are wealthy. It is a system in which some 500,000 people go bankrupt each year because of medically related debt. It is a system where in large parts of our country, rural hospitals are being shut down and where people, even with decent insurance, have to travel hours in order to find a doctor. Mr. President, as Senator Wyden indicated, in December, after months and months of difficult negotiations, and I want to congratulate Senator Wyden, Senator Crapo, and all the people involved in those negotiations, we made some progress on this health care crisis by coming together on a bipartisan and bicameral agreement on a health care package. That legislation, while more modest than I would have wanted, would have provided $4.5 billion for community health centers this year and $4.6 billion next year, up 15% from a few years ago. Community health centers provide primary health care to 32 million Americans, working class, lower income people, do a phenomenal job, but they're under financial stress. That legislation would have provided $350 million a year over 2 years for the National Health Service Corps, so we can attract young people to go out and work, young doctors to work in underserved areas. And it would have provided $300 million a year for teaching health centers. It would have also lowered the outrageous price of prescription drugs by taking on the greed of pharmacy benefit managers. It was a bipartisan bill. And just before that bill was going to be passed, Elon Musk, the wealthiest man in the world, who does not have to worry about whether he and his friends can afford health care, he sent out a series of tweets, some of them outrageously dishonest, to kill this legislation, and he succeeded in doing so. So today, Mr. President, it is important that we take a step forward and undo the damage that Mr. Musk caused. And the legislation that we are proposing today would in fact begin to take us back where we were. It would increase funding for community health centers and do all of the other important work that Senator Wyden wanted. We have a health care crisis in America today. The CR that we're going to be voting on in a little while will make a bad situation worse. This is an opportunity to tell the American people that we are aware of the health care crisis. We are at least trying to do something. And I would yield back to Senator Wyden.
President, I just want to thank my colleague.
Senator Morgan.
Mr. President, just very briefly, I want to thank my colleague. We have been working, as we've indicated, for months and months because Americans, with respect to health care, feel like they're getting hit by a wrecking ball here in terms of the costs and inability to get quality care. So with that, I ask unanimous consent that the Senate Committee on Finance be discharged from further consideration of S. 891, and the Senate proceed to its immediate consideration, that the Wyden substitute amendment, which is at the desk, be considered and agreed to, the bill as amended be considered, read a third time and passed, and that the motion to reconsider be considered made and laid upon the table.
Is there objection?
Mr. President,
Senator from Florida.
I object.
Objection is heard.
That's it? So here we have a health care
Senator from
crisis.
Vermont.
I would ask. We have a health care crisis, 85 million uninsured or underinsured people dying because they can't afford health care. We pay the highest prices in the world for prescription drugs. we have reached a bipartisan conclusion to go forward in a modest way, but it would have some impact in improving health care in America, and my Republican colleague objects. That's about it. Well, I hope the American people are watching. Thank you, Mr. President.